All right, Mary, we ready to jump start? Should we
I
do
think
that?
this is a good number of people. We were thinking 18. I don't know if we know who we don't have, but I see Billy Edmonds is connecting. He's not connected yet. Deborah's with us, Sarah,
I love seeing all the familiar names and faces and
Frida,
some
and
new ones
Bobby.
too.
Hello there.
So hang on, I know it's time. It's 2 after. I guess we can get started. Go ahead, Joe. Just talk slowly.
Yeah,
So my members can come.
Yeah, we'll welcome everyone. Happy Friday. We're really excited to talk with you and announce. I know we had kind of a nice, amazing webinar with many folks across Tennessee last week, and this is kind of a follow-up to talk about the specific equity grant that you all will be a part of. And it is going to be really aligned with Project Finish Line. So the nice part of this is that it's not going to feel like something totally different. It's going to be really aligned with what we've already been doing. And so the purpose of this meeting is just to refresh you about the Sostento team and what we have planned for you all through Project Finish Line, and then make a very special announcement that I will talk a little bit about, but Mary will give details when we get to that point in the meeting. So let's just get started. So the agenda today is to give you a little project overview about the equity grant funding and Project Finish Line and what we're going to be offering. We're going to talk about the pledged Project Finish Line funding. That's the news, is that we, thanks to Mary's efforts, and we supported Mary, but she was the one that had the relationship that has allowed us to tell you today that the $10,000 pledge will be met. And we will talk about how we will be giving that out all to you. So I love giving that news. It's the best news I could give to everyone on a Friday, but you believed in us in Project Finish Line. You believed in doing vaccinations in your communities at a time where, it's not always supported by, folks in the community, and you've been doing that hard work. And so we're very excited to be able to pay it forward back to you in the terms of this funding. So we'll go into that. And then talk about another exciting thing that Sostento would like to come visit some of your clinics and run some community vaccination events with you. So that is our agenda for today to go through. And I actually added this slide just this morning this is a prominent journalist from the TCCN. These are both tweets from yesterday showing both the urgency of the work that you're all doing and that we're going to be doing through this grant, but also the opportunity right now that we do have to take a renewed effort on vaccinations. Number one being that positivity rates are above 20% in 31 Tennessee counties. And when positivity rates are that high, that means there's more spread that we know, and there's more testing that needs to be done. And so I think that shows you the urgency of the moment right now with the Delta variant. But on the right, we also see that Tennessee is catching up in the need to be vaccinated, and that vaccination rates in your state are also rapidly increasing along with the case. So it means that right now, I think, especially with back to school and potentially young people, 12 and up, being able to, make the choice with their parents to get vaccinated, that we do have an opportunity to double down on this work and get more people vaccinated and try to end the pandemic in Tennessee. So just thought I'd start with these two tweets from, and hopefully one day we'll go to this journalist and say, hey, we have a story of success you should tell about our network. So again, I just want to go over the basics of the project. And that's, again, very much based on, starts with Sostento and who we are. You've met us, a lot of you have done the orientation, so you've seen this about who we are. Sostento, we are also a 501c3 nonprofit. We view ourselves as the nonprofit consultancy for frontline health workers. So we are here to be in your service. We're here to bring tools and services and things that will help you do your job, make your life a little bit easier, help you save more lives, help you serve more people. So that's really what we're here to do, and here to listen and to do that. And again, we want to alleviate your toughest challenges so we can help you save more lives. And what I want to do before I go to the next slide is just introduce the folks that we have on the line from Sostento. Again, you've probably heard from some of them through the work so far, but some of them are new. And this is the team that you will engage with throughout the project. So I will go around the circle and let them introduce themselves if they're available. If not, I'll hype them up. I'll start with our program manager for the network, She's a Columbia University graduate, worked with us and throughout her second year and is now full-time with us, and has just done an amazing job getting all this going. So Christine, you want to say a quick hello?
Yeah, thanks, Joe. Thank you for the hype as well. It's so great to see many of you going through orientations and just being super responsive. As a friendly reminder, we'll always be in touch and we always want to hear your feedback. So if there's anything that you want to talk further about with our team, if you have any suggestions, please direct them my way. We'd be happy to hear them. But as always, you're all doing amazing work and we're very privileged and excited to be serving you. So thanks, Joe.
Thanks, Christine. And next, I'm going to go to we have two clinic engagement specialists. So we have two folks here that will be engaging with you, the clinics, making sure that the work with TCCN is going smoothly, with any tools and services we're offering, any troubleshooting you need. So I'm going to start with my recent University of Michigan graduate. Some of our favorite employees that we bring on are folks who are in between getting ready for med school. And so Megan Manu is one of those. And so we are lucky to have her as she's in this gap year before she starts going into preparing to become a doctor and giving back that way. We love having these folks on. So she'll be with us for the full duration of this project. And Megan, do you want to say a quick hello?
Yeah. Yeah, thank you so much, Joe. Yeah, so again, I'm just really excited to be working with Tennessee. And yeah, just like Christine said, I'm just inspired about all the work that you've already completed. I'm just really excited to get to know everyone on this team more.
Thanks, Megan. And then I see our other clinic specialist is here. She doesn't have her video on, so I'm not sure how her bandwidth is. So I will hype her up, and if she's here, she can say a quick hello. If not, that's fine. So Rose Pagano is our other clinic engagement specialist that will be on this project. She is a recent graduate of Carnegie Mellon University, and she will be very much focused on helping you uptake some of your tools and services. So if you're using the helpline, we're going to talk about that. If you're using some of our free vaccine rides, or as well, she'll be helping with some of the reporting, helping you make sure that we can communicate to the government how important this grant is, the impact that it's making with you, so we can get more money to Mary to help you all in the future. So Rose will be helping you on that level. Rose, I don't know how
Hi, Joe.
Oh,
yeah, I'm here. Sorry,
Okay.
my Wi-Fi is a little spotty, so I turned off my video, but I'm here.
So say a quick hello then, Rose.
Yes, hi everyone. As Joe said, I am a new clinic engagement specialist, and basically that means I'm communicating about our programs, and I'm hoping that you guys communicate about your programs. I'm really just excited to learn more about all of Tennessee's clinics, and like Megan said, I'm just really inspired by all of your work, and I'm looking to work more with you guys.
Excellent. So this is the core team from Sostento that will be supporting your all the clinics and TCCN as part of this program. We do have other technologists and designers and marketing and communication folks that you may engage with. But if you ever have any question, the four of us are the ones you should go to first. And so we're all one team. There'll be certain things that teammates reach out to you about, but any question you have, you can reach out to any of us and we'll make sure it gets directed into the right place. So that's the team, that's who we are, and a little bit more, again, how we work. So like the idea that we're a nonprofit consultancy, well, what does that mean? So the main things that we do always starts with listening. So we're always going to be listening to what your greatest challenges are and how we can help you overcome them. And when we hear a lot of frontline health workers saying that they have the same need, we will launch an initiative around it. So Project Finish Line is an example of that, where we heard again and again from clinics, hey, Joe, we weren't ready when the spread started of COVID. We didn't know what to do. We didn't have PPE when we needed it. We didn't have testing when we needed it. And we're worried about the vaccine. Can you help us prepare for that? And so when we heard health workers across the board that we work with say that, we started Project Finish Line. So that's one of our initiatives. Once we have an initiative, we build a network around that initiative, or who are the key stakeholders that need to the initiative be successful. The initiative always has a very concrete goal. For Project Finish Line, it's 1 million vaccinations through 100 clinics. And then we want to build a network to make that happen. So TCCN is, of course, a key member of this network for Project Finish Line, and the equity grant work that we're doing with you fits right into that. So we build the network, and then once we have the network and the goal, we provide digital tools and services to help our frontline health workers meet that goal of, in this case, the 1 million vaccinated. We have another initiative that we're preparing to launch on substance misuse. And so of course, we'll bring that to you when the time is right. But the work we're going to do is under our Project Finish Line initiative, our Tennessee Equity Network for that initiative. And then we'll be talking about the tools and services that will provide you to reach our goal around the project. And this is how your journey will look. Oh, and by the way, I didn't mention this, but if anyone has any questions, please put them in the chat. The team can try to answer it in the chat, or they'll bring them to me. But if you have questions or something, you'll comment, please put them in the chat. We'll get to them. So this is the Project Finish Line journey under this grant. We've already done the acceptance into the program, and we've done your orientation. So you've all completed that. We're now in the program portion where we're going to be helping you do your vaccinations. There's a Facebook group that hopefully you've all joined where you can ask questions and get support. There, excuse me, there's Sostento support hours. These are open hours. You can jump in. If you have a question about any of the tools and services we're offering or any just general questions, we're going to be there for you on a weekly basis. And then we'll have the monthly webinars. That's the Project Finish Line All Clinic webinar that hopefully you've come to some of them and enjoyed. And then once I think we're looking at around December, I believe this grant goes through March, Mary, correct? The equity grant. And so we'll be with you, but the Sostento portion, like the main portion, will go through the end of this year. And we're going to do a celebration either end of this year, early next year, hopefully having met our mark. So this is what your journey will look like as part of the equity grant and Project Finish Line. And
So
then this,
quick question on that, on the webinars. Is that an opportunity for people to crosstalk about best practices and what's working and that kind of thing?
absolutely. Thank you for bringing that up, Mary. So what we do on each of the webinars is we feature 3 clinics to share some best practices. And the way you might be asking, well, how do I get featured to share those? We'll get to that, but on your monthly report, you'll be able to say what successes you've had. And that is how we pick our clinics. So if you report and we see like, okay, you've been doing your vaccinations and you have a really interesting success story, we will reach out to you. And sometimes we'll reach out to you to do the spotlight on the webinar, or we heard from some clinics that they've been having success on a community ambassador program. So as part of what we're doing now is we're interviewing the clinics that have been doing the community ambassador program, and Christine and team are working, and I think Rose is also working on that actually. We're going to be releasing here's how to run a community vaccine ambassador program. So that's why it's really important that you fill out your monthly progress updates. We try to make it as easy as possible. When you tell us what's working and what's not, then we can respond and help you, either by featuring you on a webinar or interviewing you and strengthening that asset for other clinics to use. So Mary, that's how that works. All right. So what you can expect from us is that if you post something in the Facebook group, we're always on there and we'll engage with you. We facilitate that. We have the support hours that I mentioned to you. And if you don't know how to sign up for those, let us know. And Christine can give you the link. It's just a link and you sign up and then you'll have the support hour. So it's very flexible to when you need it. We have the monthly webinar. And then each month we'll be giving you an operational resource to help you with your vaccinations. So we've done the helpline. We're going to be talking about our free vaccine rides. We're going to have the community ambassador program. There's other things we're looking into see what we can provide for you to help with your community vaccination work. And then fundraising. We have promised to raise the $10,000 pledge, and I'll let Mary say that, but you will be happy to know that your pledge, you all committed and we got it done. And so Mary will be talking about that we've met the $10,000 pledge, and Mary will talk about how you can get access to that. And then what do we expect from you? We hope that you'll post in the clinic, in the Facebook group for our clinics. If you haven't introduced yourself, I know a few of you have, jump in there and you'll see everyone has been introducing themselves, talking about their clinic. So jump in there and give your introduction if you haven't done it. It's a place to share an article you've read or a problem you're having, and there you'll have a bunch of other clinics to comment, and Sostento team will be in there as well. We expect that every month you're going to fill out your monthly progress report. I think you've already been doing that, and you know that if you don't do that, Rose will call you and say, hey, we need your report. So that is what we expect from you, is every month you submit that progress update. That allows us to go back to the government and to say, hey, this is what's going well, keep funding us, as well allows us to develop our tools and services and spotlight you when things are going well. Of course, we expect that you're going to continue to increase access to the vaccine in your community, either by hosting vaccine events or doing education outreach and doing referrals to whoever is doing a vaccine in your community. So you don't have to host vaccine events to increase access. as part of this program, you can education, outreach, and referrals. And then keep in touch with us. When something's going well, we want to know. If something's not going well, we want to know. So we expect that you are communicative with us to let us know what's going on and how we can best help you. So that's some expectation setting. Any questions, Christine? Are there any? No questions. We'll just keep it rolling. So I just want to make sure you are all aware of the things that we already have made available to you, and you should be utilizing as part of the equity work and grant and project finish line. So we have an education toolkit. It's available. Maybe Christine, you could grab that and put it in the chat. So that is a toolkit. There are all kinds of goodies in there. There are social media posts, there are flyers, there are FAQs, there are how to start up a vaccine site if that's what you're going to do. So that education toolkit, I see Christine's put the link in there. We update it once a month now. And I think there'll be one more update this month, which will be coming. But there are things in there that should be helpful for you in terms of education already set up. There's Helpline SOS. I know that there's a few clinics already utilizing this, and this is available. If you're interested, we can train you. It's free, no cost. I'm just going to give you a quick look at how it works. So we have 47 clinics currently using the Helpline SOS. There are a number in Tennessee, I believe Helping Hands, and I know there's a few others that have already onboarded with it, and we're excited. If you haven't already, it takes less than an hour to get started with it. Even if you're not getting a lot of COVID calls right now, get this helpline set up, because with the Delta variant, with maybe boosters, etc., will help you market it. You'll get calls. And it's a way, and I'll tell you how it works in a second, but we've done over 100,000 COVID calls with it during the pandemic. And so we've really mastered how it will work for you. And we also know that individuals that are thinking about getting vaccinated will not do it via online appointment. They want to talk to someone. So this is a way to allow people to call you, leave their information, and you can call them and schedule their appointment for them. Really easy. Again, how it works is, how the helpline works is, you don't change your phone number, you don't change your phone system. Someone calls your clinic, they're looking for a COVID related test or vaccine or information. We then intake the call for you. We intake it with the interactive voice response system, something similar when you call your bank or your health insurance company, where you press 1, press 2. We intake that information for you. Instead of voicemails, we give you a spreadsheet online, HIPAA compliant, in the cloud. You can have staff and volunteers make the callbacks from home. You make the callbacks. But it is a really great way to make something available phone-based for people that maybe not have the computer literacy. We know people from 18 to 88 can use this system to leave their information, and you'll get a really clean way to make a callback. And you'll have their age, if they're a patient of yours, do they have insurance, what zip code are they in? So you'll have all the information you need to give a really great callback. And you don't need to change your phone number or your phone system for this. So if you decide this is something you're interested in using, you can let us know if you're not already using it. But just so you know, no new phone number, no new phone system, and you're up and running in less than, I think, an hour and a half. You're benefiting from this. So this is something that will be available for you throughout the project. And if you sign up for it in perpetuity during the pandemic, we will never charge you a fee for it. It will be free. So if you're using it, great. If not, and you're interested, let us know. Yeah. So, and I think that's all with the helpline. If anyone has any questions, I know Rose has been onboarding a few clinics already from Tennessee. We have a few that have been using it before, but it's a really great tool. And something for you to say, hey, just call this number if you have any questions, and then use volunteers or your staff to make the callbacks. It's a great way to get vaccinations going. So second one is, we know that transportation is a problem, and we know that we're working on the transportation challenge. And one of the things that we have solidified is that we are working to create a free vaccine ride service that you can utilize. And we know that some clinics may not have this available because you're in a rural area, there isn't Uber. We're looking at alternatives and what we can learn from working with Uber Health, which allows the clinics to order rides for folks. You know, we're looking at alternatives, but there is one clinic that is part of already using it. I wonder if they're here. They're in Memphis. I forget the name exactly of the clinic, but is that clinic here, the group that is using the free rides already? Are you all on the line?
I don't see anybody from Memphis among the members that I see.
No, they didn't make the webinar. Okay, Christine, do you know the name of the clinic that is using it?
Yeah, Wellness and Stress Clinic of Memphis.
Oh, okay, yeah, and Peter's on vacation this week, yeah.
Okay, well, some
for
of their,
them.
well, they are already doing rides. We know they've done their first rides already. And so they're already using the service. And we are working, we know that's something a lot of folks are interested in. And the reason we haven't made it available to everyone yet is because we're working at the kinks. We actually found that the Uber Health platform is not super like friendly to a free and charitable clinic. So we want to make sure that we test everything and it's working, and we will slowly start to roll it out to more clinics. So stay tuned. And if you're interested, actually getting the helpline is a prerequisite to getting the vaccine ride service going. So that's another reason to use the helpline. But what I do want to do is share a little bit about what we've learned. We've been testing rides, and I want to share some information on it. So again, we know that using a ride share like an Uber or a Lyft isn't as easy as just saying, oh, you can use it. So we've done interviews, and we've learned that we know a lot of your patients don't have a smartphone or maybe they don't have a credit card linked to their phone, and those are things you need to use for Uber Health. We know that there's language barriers associated with it, that sometimes we've learned that folks are like, wait, rideshare, what is even that? Where's the taxi? Where's the taxi sign? I don't understand. It's someone's car. So that there's trust and familiarity that has to be overcome. And that also, to use a rideshare for the first time, your patients will need some extra support. And so that's what we're working through. We've already determined a way that you can order rides for your patients. So they don't even need to open up the app if they need a ride for a vaccine, or even we've got an agreement that if they're going to come in for another preventative or other healthcare service, but you'll talk to them about the vaccine, you'll be able to order the free ride for them, and they will never have to open up the app. So we've already designed that. We also will allow health staff and volunteers to use these free rides to do outreach. So if you want to do a pop-up clinic, home-based vaccination, or even go out and do community education, and transportation is a barrier, you will be able to order these free rides for your staff to do or volunteers to do outreach as well. So the reason we haven't been rolling out as fast as we had first wished was that we are working through these details. And we are also learning ways to increase the rides. So we know that, like, for example, there's this important dispatcher role, which is helping people to make sure they get on the car, they know what it looks like. You need to have that dispatcher role. So we're learning what that's like and how we can help one of your volunteers take on that dispatcher role. We also know that having the helpline, that someone calls for an appointment and scheduling their ride on the phone is the best way to do it. We have also gotten approval from Uber that we can use these free rides for other things. That if they're coming in for a cancer screening or a regular checkup, you can actually use the free ride for that, as long as when they're there, you do vaccine education or talk to them about getting the vaccine. So that's going to expand the types of rides that you can use this for. We're also figuring out the technical support from Sostento that you're going to need to make sure you can order the rides. It's pretty easy once you get the hang of it, but it does take some training. And also, we know that partnership building to market the rides, to have a pickup point sometimes where rides can come from a church or Boys and Girls Club or something else. We're looking at how also partnerships can help enable more of these rides to happen. So does anyone, Christine, was there any question about the rides? I see there was another chat in there. Was anyone asking a question about the rides?
There was a comment in the chat of just discussing transportation barriers for rural areas since they might not have Uber Health.
Yes. So we are going to look at alternatives. We are actually looking at a way that if you have someone who has a vehicle and is willing to do rides, they could actually sign up to be an Uber driver. And if they're the only one in your area, you could actually then get them paid to do the rides by signing up for Uber and becoming a driver, and you're the only driver in the area, then actually you can have that person be paid to do all the pickups and drop-offs. And you pretty much, you go, I want to order an Uber driver. There's only going to be one driver in the area. It's going to be your driver. So we are looking at ways to overcome that. We know that there may be alternatives with like a taxi service you may need to use. So if you have ideas, we would love to hear from you. If you're in a rural area, you're like, oh, there is no ride share yet, but maybe I have a driver who'd be interested, or there's a taxi company I can work with, reach out to us and we'll talk to you about how. We know those are longer rides too. We know that those are more expensive rides. We work in West Virginia on substance misuse, and we know that we had one of our staff had to do a 2.5-hour ride to pick someone up to take them to a recovery center. And so it's not like a city urban center where it's like 15-20 minute rides, right? It's a longer ride.
Yeah,
Um,
and Joe, I just want to jump in and volunteer Frida Lusk to work with your team because she's in an area where transportation is a huge area. She really needs help. She was the one that threw that in there.
Sure.
And anybody can help operationalize something. It's Frida.
Great. And so Christine, maybe you and Rose, I would maybe want to follow up with Frida. You can think about how we could talk to her about this. Maybe you can loop in Kim and we could do a little interview with them about the rural area and how we could do that. So yeah, so if you're in a rural area and you're like, oh, there is no Uber here yet, reach out to us and we'll do an in-depth interview with you. We'll talk to you about how we could activate a ride share or an alternative. We've worked on projects in Kentucky and West Virginia, like I said, with rural transport. And we know that it's an issue, but it's a different type of issue because of the distance and the cost of transport and the lack of public transport as well. So we are aware of that. And so, yeah, as part of this project, we can work with you on it. So please reach out. If Frida wants to put it, we have their contact, right, Christine? So maybe you and Rose, you can follow up with Frida and we can set up a call on that. All right, cool. Reporting. So I think you've been good about reporting. You'll hear from us if you don't. So there's the monthly report, which is very important that you fill out. That lets us know how you're doing, how many vaccines you've been able to achieve, and successes and challenges. As well as you'll be able to put in some supplemental funding requests. So we know that we have the pledged funding to you, but if you're trying to do something significant that is unfunded and you need more funding to get vaccinations done, we will take those on. So that's another reason to do your report. There's a link in there inside your monthly report to say, hey, I really could use some additional funding for this. It'll help us get vaccinations done. This piece of equipment, the staff, we need resourced. It's timely. If you put that in your report, we will get back to you. So another reason to fill out that monthly report. Should only take you 10, 15 minutes a month to fill this report out. We may follow up with some follow-up questions or interviews that we want to do with you, but we know you're busy. So we will try to keep the reporting as light, but the project finish line reporting that you're already doing will meet the equity grant reporting that we need from you. So we're not adding something new on. There may be some follow-up things we need from you, but this will be the mechanism. It doesn't change. You've already been doing it. And you know that you'll hear from us, from Rose or Christine, if you don't do it. So we'll keep you on track on this one. And Mary, anything you want to add on the reporting? No. Okay. So the grant and fundraising distribution. So again, I'm going to throw, was there a question? I saw another chat come in there. Christine, was there another question?
Bobby wants to know how a person can become an Uber driver and can we recruit somebody in the rural area? I think that's exactly the idea. Joe, hook everybody up on that in the rural areas.
Yes. So maybe if that's the second person, Christine, maybe now that our Helpline SOS onboardings are ramping down, maybe this thing you and Rose can take up and you can figure out how we follow up on these.
Thank you, Rose.
Yep. All right. So now the moment we've all been waiting for. The best part about this is the $10,000 pledge. We've met it. Celebrate a Friday celebration. Mary, I'll put it over to you to talk about how, when and how. I know there's still some details being finalized, but know that the money is eventually going to be making it your way. Mary, go ahead and fill in the details.
Okay, well, I love how Joe says Mary's going to tell you everything, and he tells you everything. But it's true. We really are super thrilled because the $435,000 grant that we're closest to being able to operationalize is going to be in part used to fulfill the commitment that we had to you all who jumped in back in the day when it was hard to do and not everybody, was even able to think about jumping, and you jumped in and you started really owning that this is what you need to be doing. And we're super grateful to you. So yes, we are thrilled you will be getting this money as soon as we get it. We have all the accounting systems set up. We have your ACH. We're probably going to break it up in a couple of payments. So Annabelle will be your go-to for any questions about money and operations. Annabelle Cruz. She is way, way smarter than I'll ever be about all of those things. So if you have a question, go straight to her. You can CC me. So yeah, where we are, we have an agreement, but the Commissioner Piercy needs to sign it. And so this contract term is through 3/30/22, which means that there'll be another stretch where we're bringing on people who weren't part of Project Finish Line. And you're going to be our shining stars, our leaders, to show how to do this work, because not that other people aren't doing it, but you've participated in a very supported way. And let's just hear it for Joe and Sostento and everybody that's bringing more resources, free resources to you. God love them. God love you all. So what will happen is we will extend the contract. Essentially, you'll finish up your project finish line, and that $10,000 is for the original commitment through December 2021. And then as we bring on more members, hopefully we'll get a bunch more members. This is what we have this money for, to onboard them into the work you're already doing, using the tools that Joe and the team have already developed. So we're just taking it home. We're just keeping on. And you'll see if you look at the service goals, and we'll share this presentation, I think, perhaps even share it in the newsletter, I think, Ecclesia, so everybody can see it. But it's very much the goals of our health equity vaccination project are the same as what we've been doing. So we'll add more people in, they'll get some more money. You can continue on, and we will find some additional funding to get you through to that longer time frame. Okay, I think that's it. Is that it, Joe?
Yeah.
Annabelle, did I do everything right? She says, okay, I did. Okay.
Annabelle is shaking her head. So yeah, so again,
She's the boss.
we know
She's
that,
the boss
like,
of operations.
we know that we can talk and all our tools and services, but that at the end of the day, you all need money, and we understand that, and that's always a priority for us. So this is the start, like Mary said, and we are excited that you are the second state. So you know, we are still struggling in other states, but Mary and team have really come through, and of course, Sostento, we supplied some support there, but we're happy that we know that you're going to put that money to good work in helping get more folks vaccinated in your community.
So can we stop here for a second and let members unmute if they have any questions at this point? We don't have a whole lot more detail, but you're welcome to ask a question or drop it in the chat. Just for a second. Nobody? Okay. We're so clear, Joe. We're so
Yeah,
clear.
well, that's good. I mean,
Okay.
they don't want to jeopardize it. They're like, okay, yep, sure. I don't want to just let me get that check.
Don't talk
All right.
anymore. Yeah.
Yeah. All right. So that's that. More than that soon. So the last thing is, this is an exciting announcement. We're going to have more details on our August 18th all clinic webinar. But since you know we're all here, and I want to give you something sweet. This is what it's going to be. So Sostento is planning site visits that we want to come and visit a few of the clinics in Tennessee. So if you're interested in that, we will reach out to some clinics directly. But if you're interested in hosting us, it's going to be in the mid-September to probably mid-end of October timeframe. What will happen is that Sostento wants to run a community event with you. So we want to come down. We will. We have a grant from the CDC Foundation, so we will actually come and we will resource the event. We want to make it a community event with vaccination, so it's not necessarily needs to be framed as a vaccination event. It can be a charitable, your clinic's community event. We talked to a clinic in Alabama that during a away game for an Alabama football game, we're going to do a tailgate, health, promotion event, and we'll offer vaccinations at the event. So it doesn't need to be like this is for vaccines only. It can be a community event. We'll do some local media outreach. So we'll get the local paper there to cover the event. We'll do a Project Finish Line celebration. And we're trying to think about some incentives for people who do decide to get vaccinated at the event, whether it be a meal or a gift certificate or something we want to do with you. So I will be on the roadshow, so you'll get to see me and at least one other staff member. We're talking about maybe Christine doing some in Texas where she is, in California, Texas area, maybe Megan doing some in Wisconsin in the future where she is, and even Rose, I know she's in Pennsylvania where she is. But our first series of these events will be between where I am in New Jersey and Atlanta, and so you are on the route. So if you're interested to have us stop by and have some fun with you and run an event, let us know. But we will be reaching out to a few also clinics that we would really like to do this with. So I see some chatter in there. Can't see the chatter, but hopefully people are saying like, let's do it. But that'll be fun. And so yeah, mid-September to October timeframe. And that's it. That's the last announcement for the webinar today. So if you have any questions, please put them in the chat. Again, you can always reach out to me, Christine, Megan, or Rose. Reach out to us if you have any questions. We're pretty responsive. We all well connected to our digital devices, so we'll be pretty responsive to you. You can always call, if there's something urgent. But that's it. So we can open up, Barry, back to you for some Q&A. But just really, really excited to take this on with you all.
Okay, and let me just, Annabelle, if you would like, we are working on other funding opportunities for members. We have been told that we will get the funding opportunities that I told you about on the webinar last week. So I don't want to go back over those, but we are trying to apply continuously. We're going to grow TCCN's funding stream continually with Joe and the team's help. And on our own little steam, because we now have a team with great expertise. So we want to support your work, and I finally feel like we've got some resources to do that. So it's a great gift. But anybody want to jump in and ask any questions? You seriously are welcome.
I think everyone's in that Friday mood, but
Yeah,
I
they're
did,
like, let's
I did
go.
see some folks that they were ready to have Sostento come and have a little party with them. So we
Oh,
will
yeah.
definitely, that was cool to see it. And we'll definitely reach out. We're going to do as many as we can. And some we run events with, some we'll stop by. Anyone on our route, we're going to have some swag. We're going to have some t-shirts, some other stuff.
I'm going to be there. We'll get to be there.
Sounds good. Yeah, that'll be fun. So yeah, we will then be reaching out with that probably next week. We're going to be reaching out. And so thanks everyone. Yeah, I like what Billy said. Let's rock this. I think that's a good note to end on. Let's do it. So here's to a fun and fruitful collaboration together on this equity grant. We know there's another grant that's going to take us even more into the future. And like Mary said, we're not done. This is just the start. So we're excited and motivated to inspired, like both Megan and Rose said, we're inspired by the work that you do. And we're really happy to be able to support the free and charitable clinics in Tennessee. So Mary, you can close this out if there's any last things. Otherwise, we'll give everyone the rest of their Friday
No,
day.
go have your Fridays and your weekends. We're here for you. If you need anything, reach out. Bye, everybody.
Right. Thank you, everybody. Take care.
Bye.
Cheers.
Bye. Thank you, Mary.
Thank you, Frida.